We sought out to investigate why patients with cancer were taking the combination of ivermectin and mebendazole. Ivermectin and mebendazole are both anti-infectives, but they have anti-cancer properties. In preclinical studies with ivermectin and actually in clinical studies with mebendazole, both drugs by separate mechanisms do three things. They reduce tumor proliferation, reduce angiogenesis or blood vessel formation around the tumor, and then they cause the tumor cells to shut off, apoptosis. And so we had about 200 patients go through the study. I believe just over 120 were at the 6-month mark. They reported in on their CT scans and PET scans and how they were doing. Now, the most common cancers were prostate in a man, breast in a woman, and then lung cancer in both groups. They were mainly solid organ cancers. A third were already in remission to start with, and then the rest of them had active cancer. And so what we found is that those largely in remission stayed in remission. About a third with active cancer didn't progress, which is great news. And then 16% of patients, there was a regression. The metastasis improved. So this is great news. This is what's called patient-reported outcomes. The overall net positive of this was about 84% of patients. It was a wise thing to do. About 25% had acceptable side effects, GI side effects, so it's a real-world study. But it is patient-reported outcomes. All of this needs to be verified, and it's a clear signal to Robert F. Kennedy and the National Cancer Institute and Dr. Jay Bhattacharya in the NIH to do a large prospective randomized placebo-controlled trial.